And what Haniman sir has told us, we have to be a keen observer. What is keen observation? Keen observation means you have to understand the facial expressions, the gestures, ooh, ooh, whatever I'm doing. How am I sitting? Am I sitting like this in a very decent way, or I'm sitting like in a very egoistic way, or I'm sitting in a very at the edge of the seat and I'm sitting at the corner. I'm very much awkward, very shy, like uh, mm, mm. How boldly I'm talking with the physician for the first time. Am I very comfortable? Am I very embarrassed? Am I hiding my weaknesses? Like, oh my God, am I that fearful, anxious? These are the objective symptoms, and this is an art. This is an art. When I'll come to name some other remedies, I'll be showing you these artistic things. But how to pursue the mind section of the repertories, you are the one who are deciding. We cannot teach you mind section of the repertory. Materia medica, we can teach you. The physicals, concomitants, modalities, sensations, everything we can teach you. But mind symptom, you need to perceive with the extra understanding, with the quality of keen observation, with the quality of, and that is really very interesting. So once you understand this observation skill, I will be showing you off. You will come to know, "Arey, what beauty!" And my dear friends, I cannot show the video because it was a very private video because she was exposed everything. So it cannot be in the social media. But one dose of Hyoscyamus 200 and it was working like a atom bomb. And you don't even know how beautifully it works. Because she had a feeling that you had to see the disease in detail. Please, because everybody knows about the suspiciousness of Hyoscyamus. The poison feeling we have in repertory, fear of being poisoned, fear of that the people will do harm, the medicines will do harm. Same fear Hyoscyamus carries. So Hyoscyamus exposed her breast in front of the physician. So, see, doctor, this is the thing what I'm saying. Please don't give me wrong medicine. So, why did she do this? Why the Hyoscyamus patient wants to be naked? Because she wants to know, she wants to show the physician that please give me the right diagnosis. Don't mistake in your diagnosis. There should be no error in your diagnosis. So the medicines should be also, there should not be any error. So I don't want to suffer more. Instead, please give me such a medicine that I will be benefited. So please see my disease totally in front of you. I'm putting it in front of you. High exams. Okay. So this is how we understand. So now we are trying to show you how we understand the expression. Now I'll tell you, I'll be showing you some things. Please understand this. Everybody knows about the painlessness of opium. Do you agree this? But how to understand this is content only. Kent's, I have taken all Kent's rubrics. Content. What do you mean by content? Content means I am not affected. I am not affected. Take care. It's okay. We know that rubric well says he when very sick. Now, how will you understand a person? Now, see the old woman. See the expression of the woman. Now, imagine this woman is suffering from any bad pathology. For example, I always give a case of a small child. A small child. I always do this, and I always try to give this. Just a minute. Stop. You saw this case, right? I always give this example. A small 2-year child suffering from fever. So, what will be the normal behavior of this child? Normal behavior. First, we should know what is the normal behavior. Then we'll understand the peculiar and individualization of the behavior. The normal behavior of the child will be cranky. If at all the temperature is 102 degrees Fahrenheit or the temperature is around 103, 104, then the child may be dull. The child may be moaning, crying. Mama, oh, The child may be restless. Ah, ah. There may be one cheek hot, one cheek pale, like chamomillas and aconites. There may be restlessness, impatience, irritability. है ना? 2-year-old child. How will you identify the content of this room? Content means not affected, means painlessness, means I'm the child. I have shown a case of a child suffering from pneumonia. I've shown this case in a webinar seminar. I cannot show every case in this social, this privacy issue will be there. So I will avoid to show those cases, but I'll try to the child's 103-year-old child suffering from pneumonia. The X-ray chest was bad, 103, and the child was like this. Look into my eyes. Look into my eyes. He was like this. The eyeballs were not revolving. Now observation. When I touched the child, the temperature was 103. You know, oh my God, the temperature is so high. So the mother said, this is very interesting. The mother said, that's what I'm telling you, doctor. In spite of this high temperature, the child is not at all complaining at all. The child is not at all complaining, just lying down like this, as if nothing has happened to this child. Isn't it not very important and PQRS? Just introspect. Just understand the beauty of this repertory. Just understand the beauty of the language of vital force and the language of repertory. When the language of vital force and the language of repertory matches, simile. In opium, it has clear cut written in the materia medica, painlessness of the symptoms. There are two sides of a remedy. One is a very hyperactive and one is the contented side. Okay, now I'm talking about this contented side, the silent, the painless. A case of abscess. I'm telling you, write it down. Write it down. I've shown in my a case of abscess. And that too, abscess here, the most painful part, axilla. Yes, right. Eye staring. Exactly. The abscess was here. So when I examined the abscess and when I tried to touch the abscess, it was hot, tender, and absolutely very painful. I could see that there must be intense pain. But the opium child, 7, 8 years old, he didn't even see if I told my abscess is very painful. Now, this is common sense. If my abscess is very painful, what would be my normal reaction? Don't touch me, don't touch me. How Hipparcel does. How Hipparcel, hey, don't touch me. The individuality I'm talking about. What will Hipparcel do? Hey, please don't. Touch aggravation, touch jar motion aggravation. Even the slightest breeze of air will give that pain. Sensitive to pain, sensitive to be approached, sensitive to touch, anger touched, Hipparcel. But what is this opium doing? Isn't it not the individuality? This opium is just asking me to, you can touch. In spite of the fact that it is so painful, still, you can touch. This painlessness is the key of opium. Now, isn't it very important? And why this painlessness is always with content? Content means It's okay. Since morning, now it's evening, I have not consumed a single glass of water. I'm very thirsty, but still, but now I'm not able to find any glass of water. It's okay. Content. So whenever ask a person here, what is your sugar level? 365. So 365, the physician gets worried. 365. Huh? Uh, you don't feel anything? It's okay. It's okay. It's okay. Calm down. Content. With indifference to suffering. Write it down. Those who are for the attending, the students, I'm telling you, write out the rubrics. You'll find out in the mind section of the repertory. Mind, indifference to suffering. Means what? It makes no difference to me. It's okay. Doctor, it's okay. Opium. So many cases. I'll give you a tip of opium. A child goes for vaccination. 99.9 kids start crying and yelling. Do you agree? But this opium child, the child will be this like this. In spite of injection, the face of the child will be like this. I'll be sharing this content face to all of you so that you will come to know what do we understand by the gestures. What is the importance of gesture? This is the content feeling. This is the content feeling. Now imagine a 93 years old woman. She is content. Imagine a 12 years old child. Still the face expression will be same. Imagine a 39 years old diabetic person. The expression will be the same. But the rubrics are very important. Content plus indifference to suffering. Now, I have was really fascinated with all these rubrics. I will be showing you some rubrics which fascinated me, my dear friends. What rubrics means? Sometimes these are some small rubrics I am sharing with you, my dear friends. But there are so many rubrics in materia medica, this mind section of the report, which I just can't ignore to tell you. Bargaining. एक minute, I just yeah. So respected desires to be respected. My God, single hamamelis in Patak sir repertory. I'll show you the connection. I'll show you the connection. Respected desires to be respected in Patak sir's repertory. I'll show you the connection. How materia medica and how materia medica and repertory go hand in hand together. Beautiful. I'll show you. My dear friends, in homeopathy, you need to be that passionate. I always say this passion, without this passion, there is nothing. Respected desires to be respected. Respected desires to be respected. Let us search for Phatak sir's repertory. What Phatak sir has to say with hemamalis. One sentence and hemamalis is over. Everybody knows this. The principal action is on the veins, bleeding, dark, hemorrhoids, hemorrhage, varicose veins, congestion, everything we know. Oh, piles, congestive fullness, naughty varicoses, hemorrhages, capillary drug, everything one knows. Everybody knows about injuries. Now, see, am I visible? Srushti, hello.
Yes, sir.
Is
Yes,
it
sir.
visible? Na? The
Yes, sir.
mind section. See what Pathak sir has written in mind section of the repertory. Pathak sir has written that he is very forgetful, no desire to study or work. That is common. But now see how he defines a person. Wants the respect due to me. क्या लिखा है? Wants the respect due to me shown and hemorrhages with tranquil mind. Means what? I'll tell you. One sentences. One sentences and see the rubrics of Hamamelis. Ailments from not being appreciated. Means what? Saying a rubrics. See the rubrics. Lamenting appreciation because she's not. Hamamelis and calcarea self.
With the online course starting from December, where me along with my colleagues across the world, including my teachers, Dr. Sarkar, Dr. Gajanan, Dr. Borkar, other colleagues in UK, in Croatia, will be joining to teach a 30-hour online course only on weekends with 25 lectures, with an access for 2 years for you to watch the videos again and again, with a WhatsApp group where you all will be joining and trying to solve cases every week, also kind of training there. And this course will be starting in December. There is a special close to 25% discount for all you people for the early bird. So the seats have already started to kind of register. We have the last few seats. I want all of you to be a part of this, and I want to study with all of you together. So you have all the details, gaurang@gmail.com, and all the contact numbers. I look forward to have you with me. Thank you, bonjour, and merci beaucoup.